Do you have diarrhea? What to do and what not to do?
What you eat and drink during diarrhea can make a big difference. And if you have blood in your stool or high fever, this video is especially important.
First priority is rehydration.
The most important is preventing dehydration. Every loose stool causes loss of water and electrolytes. So your first choice should be ORS. Take frequent small sips rather than drinking a large amount at once. If there is severe dehydration, persistent vomiting, inability to drink, confusion, very little urine, or marked weakness, you need urgent medical attention and may require IV fluid.
Should you stop eating?
No, you generally do not need to starve yourself during acute diarrhea.
Foods such as well-cooked rice, porridge, idli, toast, potato, banana, vegetables and other simple meals may be easier to tolerate. Foods to temporarily avoid.
First, very fatty and fried foods. Avoid things like deep fried snacks, greasy fast food, and very oily meals if they worsen your symptoms. Second, large amount of sugary drinks. Soft drinks, very sweet juices, and other drinks containing large amount of simple sugar can sometimes worsen diarrhea. You can have potassium-rich fruit juices. Coffee and tea is a spasmodic agent, which means causes gut motility and triggers bowel movement. Hence worsens dehydration by increasing fluid loss. And avoid alcohol while you are having diarrhea.
What about milk?
After acute diarrhea, some people temporarily develop lactose intolerance because the intestinal lining has been affected, causes bloating, cramps, or worsening diarrhea. Reduced or avoid it temporarily, but you don't necessarily have to completely eliminate all diarrhea if you tolerate it.
Important. Shigella and dysentery.
Now let's talk about Shigella and other inflammatory diarrheas. If you have frequent stools associated with blood or mucus, fever, abdominal cramps, or urgency to pass stool, this can be dysentery. Shigella is one possible cause, but it's not the only one. Other infections including Campylobacter and certain strains of E. coli can also cause bloody diarrhea. So don't assume every episode of bloody diarrhea is food poisoning and treat yourself at home.
Do not self-medicate.
If you have bloody diarrhea or high fever, don't casually take antidiarrheal medicines such as loperamide. Some patients with bacterial dysentery require specific treatment, and antibiotic choice should be based on the clinical situation and local resistance pattern. So remember, ORS, adequate nutrition, avoid food that worsens your symptom, watch for red flags. Blood in stool, high fever, severe abdominal pain, dehydration, or persistent diarrhea. See a doctor rather than treat. Save this video and share it with someone who needs to know.